Most people think numb, tingling feet after 60 are just something you live with, a permanent souvenir of getting older. But what if 7 minutes of simple stretching, done right, could start waking those nerves back up? Hello, health champions. Dr. Elias Hartman here. Today we're covering 7 simple stretches that target numb feet after 60, and stretch number 3 is one almost no doctor shows you in a regular 15-minute checkup. Stick with me, because by the end of this video, you won't just know what to do, you'll understand exactly why it works. Let's start where the problem usually starts, the muscles and joints of your foot and ankle. The first 2 stretches are toe spreads and ankle circles. Here's what's happening when you do them. Your toe joints have a thin layer of synovial fluid inside them, kind of like oil in a hinge. When you don't move your toes much during the day, which most of us don't, stuck inside shoes, that fluid gets sluggish and the joint capsule gets a little stiff and dehydrated. Spreading your toes apart and circling your ankles 10 times each direction pumps that fluid around again. Think of it like squeezing a sponge that's gone dry. The first few squeezes don't do much, but keep at it and it starts soaking up moisture again. A 2019 study out of the University of Michigan found that older adults who did daily toe and ankle mobility work saw measurable improvements in foot joint flexibility within 2 weeks. Next thing that happens is in the nerves themselves, and this is stretch number 3, the tibial nerve glide. Most doctors don't teach this one because it's a physical therapy technique, not a stretch in the traditional sense. Here's the mechanism. The tibial nerve runs down the back of your leg into your foot, and over years of sitting, poor posture, or even old injuries, that nerve can develop tiny adhesions, spots where it gets slightly stuck to the surrounding tissue instead of gliding freely when you move. When a nerve can't glide, it can't conduct signals as efficiently, and that shows up as numbness or tingling. The nerve glide is simple. You point your toes up while straightening your knee, then gently tilt your head toward your chest. And you alternate that for about 10 slow reps. It's not stretching the nerve like a rubber band, it's flossing it, sliding it back and forth through its tunnel to free up that movement. Imagine a garden hose with a kink in it. You're not trying to stretch the hose longer, you're just working the kink loose so water flows again. A 2021 study from the University of Queensland found that nerve gliding techniques improved nerve conduction velocity in adults with peripheral sensation loss. There's also an effect on your heart and your circulation, and this is where stretches 4 and 7 come in, the wall calf stretch and the ankle pump. Your calf muscles aren't just for walking, they're sometimes called your second heart, because every time they contract, they squeeze the deep veins in your lower leg and push blood back up toward your heart. This is called the skeletal muscle pump. When you sit too much, that pump goes idle, blood pools in your lower legs, and your feet get less fresh oxygenated circulation, which makes numbness worse. Pressing your heel into the wall for a 30-second calf stretch, then doing 20 ankle pumps reactivates that pump mechanically. It's like jump-starting a car battery that's been sitting too long. The engine doesn't need anything new, it just needs that connection reestablished. Furthermore, there's a metabolic piece most people never connect to numb feet, and that's stretch number 5, picking up marbles or scrunching a towel with your toes. When small muscles in your feet contract repeatedly, it triggers something called GLUT4 transporter activity. In plain terms, muscle contraction acts like a key that opens little doors on your muscle cells, letting glucose in from your bloodstream without even needing insulin to ask first. This matters because elevated blood sugar over time is one of the biggest contributors to nerve damage in the feet. A 2017 study from Stanford observed that short bursts of small muscle activity in the lower limbs improved post-meal glucose uptake in older adults. Last system, your brain and your hormones, and this is stretch number 6, rolling a small ball or frozen water bottle under your foot. Your feet are loaded with sensory receptors that send signals up your spinal cord to your brain, helping you sense the ground, balance, and adjust your steps without even thinking about it. When sensation is dulled, that feedback loop weakens, and that's a big reason falls become more common with age. Rolling the ball stimulates those receptors directly, kind of like turning up the volume on a radio signal that's gotten faint. This kind of repetitive, novel movement has also been linked to small increases in BDNF, brain-derived neurotrophic factor, which supports nerve health and helps lower cortisol, your main stress hormone. A 2018 study from the University of British Columbia linked plantar sensory stimulation in older adults to improved balance scores over 8 weeks. Now, you might be wondering, if my feet are numb, doesn't that just mean the nerve damage is permanent? Here's the honest, nuanced answer. Some causes of numbness, like advanced diabetic neuropathy or certain structural nerve injuries, absolutely need medical management, and these stretches aren't a replacement for your doctor's care. But a large amount of day-to-day numbness in people over 60 isn't from destroyed nerves. It's from reduced circulation, stiff joints, and nerves that have lost some of their normal glide and signal strength. That kind of numbness often responds well to consistent movement. It's not all or nothing, and that's actually good news. Let's talk timeline, because I want to be honest with you. In week 1 and 2, you probably won't feel dramatic changes. What's happening is invisible. Your nervous system is starting to recruit pathways more efficiently, and that tibial nerve is slowly regaining some glide. By week 3 and 4, many people start noticing odd little pins and needles sensations, almost like your foot is waking up. That's actually a good sign. It means circulation and nerve signaling are increasing. By month 2, that tingling often settles into more consistent feeling, especially in the toes, and your balance may feel steadier. By month 3, many people report noticeably less numbness during daily walking and more confidence on stairs or uneven ground. Here's a number that might surprise you. 7 stretches, about 2 minutes each, comes out to 14 minutes a day. Do that consistently for 90 days, that's 21 hours of cumulative nerve and circulation stimulation in just 3 months, more deliberate foot and nerve care than most people give their feet in 5 years. Now, if you've got limited mobility, here's how to adapt this. If standing for the calf stretch is hard, do it seated with a resistance band looped around your foot. If getting down for the marble pickups is tough, do it from a chair with your foot flat on the floor and just curl your toes under repeatedly. And if you genuinely can't do all 7 some days, even doing the ankle pumps and toe spreads in bed before you get up still gives your circulation a head start. There's no version of this where you're excluded, just a version that fits where you're at right now.
If you found this helpful, you'll probably want to go back and watch our video on the 3 bathroom habits that quietly raise fall risk after 60. It pairs perfectly with what we covered today, since better circulation and better balance go hand in hand. I want you to picture something for a second. Picture yourself a year from now, walking to get the mail and actually feeling the ground under your feet. Picture stepping off a curb without that flicker of fear. Playing with your grandkids on the floor and getting back up with confidence, staying steady, staying independent, staying you. That's not a fantasy. That's what consistent, small effort builds over time. If this video helped you, hit subscribe, tap that bell, and turn on notifications so you never miss a life-saving video. I'll see you in the next one, Health Champions.